In the Eastern Cape, most of the medical legal claims emanated from one Johannesburg-based law firm. We are able this morning to name the firm today because they've already been charged in a court of law. This one we are naming because it's there in court. This is the Nonxuba Attorneys Incorporated. The department paid 373,850,748 rand 04 to Nonxuba, the attorneys have mentioned, for 22 claims between 2018 and 2021. However, several years later, an inspection by the SIU revealed that none of the claimants had trust accounts registered in their names as ordered by the courts, and their living conditions were found to be deplorable and impoverished. This means that Nonxuba attorneys have pocketed all the money for themselves. Most of the claims were targeting cerebral palsy. This is a condition in which babies develop some form of brain damage due to deprivation of oxygen during the process of birth. The SIU has identified numerous cases in the Eastern Cape where the living conditions of the claimants and their children remain appalling despite having received compensation from the department, which money has been paid to their lawyers. We are counting millions here that the department already paid in the Eastern Cape, but the patients for which they were claimed are living in abject poverty because they never received a cent. Many of these claimants are unemployed and rely on social grants from SASSA for their livelihood, despite millions having been deposited into their lawyer's account. Some households are constrained into a single room or a small rondavel without appropriate railing or ramps to assist disabled children, resulting in inadequate living conditions and insufficient caregiving, despite the fact that in the claims, money has been paid for this type of facilities. Furthermore, the SIU found that these children continue to place a burden on the already strained public health care system, whereas in the claims in court, the lawyer cited future medical care based on fees charged in private hospitals. In other words, they'll say this child must get the best care in a private hospital, and we demand so much, and that money has been paid, but they will never see the inside of any private hospital. They will still come to state hospitals. The level of abuse was such that some of the claims were made on behalf of patients without their knowledge. Elderly people who are taking care of their grandchildren in the absence of their mothers were tricked into signing the power of attorney to sue the state, whereas they were told that they were signing SASSA forms for child support grants. This was very, very prevalent in the Eastern Cape. This simply means that legal practitioners or their scouts were masquerading as social workers from SASSA. Most of their claims, as mentioned above, were of children supposedly born with cerebral palsy. We say supposedly because many of them were not actually. As Nonxuba was submitting these claims, which we said were 44, 9 of them, which were for children with cerebral palsy, were all 15 million rand. And it was very suspicious. And we believe it indicates a lot of cut and paste, where you sue for one child, then you just run around the village, you're looking for some more children, and you submit the same claim, you just change the names. We think that's what Nonxuba attorneys were doing. This is so because when people claim, they claim for things like future medical care, loss of earnings, loss of amenities of life, etc. They can never be identical for each and every person. But in this case, the 9 were identical. That's why we're very suspicious. There is evidence of collusion between attorneys touts, unfortunately, nurses and doctors in both public and private healthcare. In some instances, nurses stole the medical records and illegally handed them over to attorneys. Now, after this file is stolen, the attorneys will then apply through PAEA, Promotion for Access to Information Act, for the same record that they know they are illegally in possession of. In other words, you steal a file, keep it in your office, and go to apply via PAEA and say the hospital must give you the file, when you know very well that you have already stolen it. And so naturally, such a record will not be found. The hospital will search and search, go to the archives, search for many weeks on end. They will never find the file because it's in the possession of the lawyer. Then the lawyer will come and claim fees from the department for failing to produce records. And this was also found to be very prevalent. Unfortunately, very unfortunately, there was also collusion involving some officials in the office of a state attorney, whereby out-of-court settlements for hefty sums were entered into without the mandate or even the knowledge of the department, even in cases where the department would have been able to defend. Litigating attorneys will even sue for one case in two different courts. A variation of this situation is where two different lawyers will claim for the same patient using identical details, but they submit them to different courts. Notably, whereas the patient is one person, the two attorneys will claim vastly different amounts. In the case of this patient, which you can't name, one attorney was claiming 7.5 million, and the other was claiming 25 million. But the condition for which they were claiming was the same.